Welcome to Women Empowerment. This is Victoria Showme, your hostess. Thank you so much for joining me today. I really appreciate your time. And I hope you've been tremendously blessed with the episodes on the power of positive mindset. If you haven't seen them, please take your time, scroll through, and you'll be able to see these videos. Please watch them, and as you're doing so, the Lord will bless you and the Lord will move you forward. So today I have a new topic for you, and that has to do with your heart. I'm going to be talking about one of the diseases that have a significant impact in the communities of African Americans, and that is high blood pressure. High blood pressure. So I take my Bible verse from the book of 3 John, verse 2. 3 John, verse 2. And it says, Beloved, I wish above all things that you may prosper and be in health, even as you also prospers. I wish above all things, my fellow women, that you prosper. But the main thing is that you be in health, to be able to enjoy the labor of your hands, to be able to be present on those days when it is time for you to celebrate and to rejoice and to dance. And that is why I'm talking on this topic today, high blood pressure. Now, the month of February is an awareness month for cardiovascular disease, especially in this country, because it has a significant impact in the lives of everyone, but most especially the African Americans. So note this, that health is wealth. When you are healthy, you'll be able to pursue wealth, and you'll be able to enjoy the wealth you've accrued. So, from this is a statistics from the American Heart Association, and they said 85.6 million people have a cardiovascular disease, a heart disease. About 67 million people have a high blood pressure. High blood pressure. And heart disease is the number one cause of death. Is the number one cause. There are so many diseases out there. We have AIDS, we have cancers, but heart disease is the number one cause of death, and the number one killer of women. Number one killer of women compared to any other sicknesses out there, any other diseases. Heart disease is a major disease that can shorten the life of anyone. 1 in every 4 deaths in this country, 1 in every 4 deaths is as a result of a heart disease. A heart disease. I mean, basically, when we talk about heart, your heart, I mean, that is the power function of your whole body. That is the part that functions, that pumps out the blood to all the vital organs in your body, that let them function. So if this heart is unable to do that job, not only does it affect itself, it affects every other part of your body. And once the heart fails, I mean, you can know what will happen. So that is why I'm talking about this today. I happen to be a nurse by profession, so I have some experience in this field, and that's why I'm able to share it with you. I did a research when I was doing my master program, and I chose this field, heart disease, because it has a significant impact on the lives of African Americans. A very significant impact upon their lives. High blood pressure is most common among African Americans. Very common among African Americans, and it's more severe in our communities compared to the other communities, compared to the other ethnics. More common among blacks, among we African Americans. And also, it develops earlier on in life. Early 30s have high blood pressure. Late 30s, 40s, 50s, I mean, it starts on earlier on in life. High blood pressure. And it causes a permanent damage upon the heart. When it damages the heart can no longer function as it used to. And also, they call it a silent killer because people can have uncontrolled blood pressure without any sign, without any symptom, without no complaint. You can see them walking as a perfect human being. But meanwhile, they have a high blood pressure, which they never know. And that is why it kills people unknowingly. People sleep, they never wake up. They have stroke just like that because they never take time to check their blood pressure. So when you talk about high blood pressure, what is that? It is a measurement that just checks how your heart pumps out the blood and relaxes, pumps and relaxes, pumping out the blood that carry oxygen to all the parts of your body. How it pumps and relaxes to function, to send out the blood. You can check your blood pressure anywhere. You don't have to be at the doctor's office. Go to a local store, all these pharmaceutical stores, or the CVS, Walgreens, even Walmart, Kmart, Sam's Club. They have a station there where you can just check your blood pressure. The normal blood pressure for an adult, the upper one should be 120 or below, and the bottom one should be 80. So 120 over 80, that is the normal. If you are not going to between 120 to 139, between 80 to 89 for the bottom one, we call it pre-hypertensive. That means at this stage, you need to monitor closely your blood pressure. Monitor closely what you eat, your weight, and all of those things. And if your blood pressure goes over 140 over 90, that is not very good. That is high blood pressure. But the thing is, high blood pressure is not diagnosed just one time. It's a series of readings at different times before your doctor can say you have high blood pressure. And it's only the doctors, medical doctors, that can diagnose you and prescribe treatment, either medications or modification of your lifestyle. So you have to check in with your doctor before you start any treatment to make sure it's okay for you to do that. So please check your blood pressure. So what are the risk factors? The risk factors include family history. If your dad, your mom have high blood pressure, sure, you may be at risk. You're at risk of that. And also if you're obese, if you're overweight, check your weight. Make sure you have a normal body mass index. Check it. If you're obese, please, you need to work to reduce your weight. And also if you eat a lot of salt, as African Americans, we have a very high sensitivity to salt. We have something in our gene that makes us very sensitive to salt. And so if you eat a lot of salt, it increases your blood pressure. That's why we say don't add salt to your food. Once it's done, just eat it like that. And also to reduce your carbs, your white foods, to reduce those things. And that will help to manage your blood pressure. So finally, before I leave you today, I want you to take time this week, please, and please, my fellow women. It is very, very important. You want to be there to celebrate your children. You want to be there when they walk across the stage for their graduation. You want to be there when they are getting married. You want to be able to dance and celebrate. It is very important that we take care of our hearts. I'm a woman. I work in the corporate work. I work and I have my children. I have my family. But sometimes we have to maintain a balance. We do so much for other people. We have to pause and take care of ourselves. We have to pause and relax. That this is me. For you to be able to take care of the children, to be able to take care of the husband and the entire family, I have to be in good health. And that is the message in 3 John verse 2. Beloved, I wish above all things that you may prosper and be in health, even as your soul prospers. Please, my sisters, check your blood pressure this week. Check again, and if you have any concern, please call your doctor and make an appointment to see him. So I'm going to continue this series next week, just to round up, to bring a close, and to give you some tips, some things you can do to manage your heart, and also to help you maintain a healthy weight and a healthy lifestyle. Thank you so much. God bless you. Have a wonderful week and have a wonderful month. It is well with you. Bye for now.